Lillia, you're welcome.
Yeah, thank you so much. I'm Lillia Domnichova from Hilfe zur Selbsthilfe. I'm External Relations and Coordination Officer in Kiev. Kherson is a region where war is a part of everyday life. It's continuous shelling, severe infrastructure damage, which were mentioned, and the long-term consequences of the destruction of Kakhovka Dam have placed enormous pressure on essential services, particularly healthcare. Today, only around 70,000 people remain in city compared to more than 300,000 before the full-scale invasion. Despite this, hospitals continue to operate, often under constant threat. Within the solidarity partnership between the city of Bonn and the city of Kherson, Hilfe zur Selbsthilfe has been supporting healthcare and essential services in the region since 2023 through the project Bonn Hilft Kherson. Over the past 3 years, HELP has supported 6 medical facilities in the Kherson region with essential medical equipment and supplies, contributing to improved access to healthcare under extremely difficult conditions. Our support is built around direct cooperation with medical facilities. Everything begins with the request from hospitals when they face critical gap, its shortages of medicines, outdated diagnostic equipment, or technical limitations that directly affect patients. Once the request is received, our team conducts a needs assessment, review and technical specifications, feasibility, and the security situation. Work in close coordination with the Agency for Regional Development, local authorities, and hospital management. Continuous security monitoring is essential as medical facilities themselves are frequently exposed to shelling. Every delivery is planned based on up-to-date risk assessment, route planning, and contingency measures. This approach allows us to provide targeted needs-based support while operating in highly insecure environment. Over the past 3 years, our support has focused on strengthening diagnostic treatment and emergency response capacity. Medical equipment delivered within the project includes ultrasound system, endoscopic equipment such as bronchoscopes, gastroscopes, blood bank, as well as essential medicines and consumables for endovascular surgery. Altogether, this support has benefited at least 23,000 patients across Kherson region. One of the facilities we support is Kherson City Clinical Hospital named after Karabelish, a major referral hospital in the region. Here we delivered essential medicines, including cardiovascular drugs, pain relief medication, and hepatoprotectors, which were immediately distributed across inpatient departments. This support is particularly critical for elderly patients who depend on uninterrupted access to medication. Another key facility is Kherson City Clinical Hospital, named after Tropin. There we delivered an expert-class ultrasound machine to replace an outdated equipment that had significantly limited diagnostic capacity. The new system allows doctors to detect internal injuries and complications that were previously difficult to identify, particularly in trauma cases and complications related to shelling. As an ultrasound specialist from the hospital described, thanks to the new equipment, we detected liver damage in time, and the surgeons were able to save the patient's life. The hospital also received the video gastroscope, further strengthening its diagnostic work. A particularly important case is the Kherson Regional Children's Hospital. It's the only specialized pediatric hospital in the entire oblast. It provides care for children from birth to 18 years old, including children from recently deoccupied communities. Despite constant danger and even after recent shelling that damaged the hospital building, the medical team continues admitting children and providing care every day. Within the Bonn Hilft Kherson project, the hospital received advanced endoscopic equipment, including a bronchoscope and a gastroscope. This equipment enables complex diagnostic and life-saving procedures for children in critical conditions. Alongside direct healthcare support, our assistance also addresses the broader conditions that allow hospitals and essential services to function. We supported the Kherson Perinatal Center with a high-capacity oxygen concentrator, enabling safer anesthesia during surgeries and especially childbirth. In addition, under other components of our assistance, we provided fuel support across the wider Kherson region to keep essential services ongoing. This included fuel for water supply for people, for generators, points of invincibility, and outpatient clinic. Without electricity, heating, and water, healthcare facilities cannot operate, and this complementary support remains critical. Looking forward to 2026, our priorities within German-Ukrainian cooperation are to maintain continuity of essential services, strengthen long-term institutional partnerships, and continue working through local systems. Our experience shows that this approach works when assistance is flexible, needs-based, and grounded in trust. At the same time, we continue to face serious challenges. The most significant remains the security situation, which affects logistics, planning, and access to territories. Infrastructure fragility is also worsened by repeated attacks, further complicates the work. Despite these constraints, our experience clearly shows that cooperation rooted in local partnerships makes a real difference. When support responds to actual needs and is sustained over time, hospitals are able to continue providing care even in highly insecure environments. Thus, medical teams in Kherson demonstrate extraordinary resilience every day. Our responsibility is to stand alongside them and to ensure that they have the support they need to continue this important work. Thank you very much for your attention.
Thank you, Lillia. Thank you very much also for your work. We know how civil society and how the NGOs are struggling during these years, but also within the resources are doing everything possible, what I call that. And I wanted to ask you also to concretize, is there already a network that you're using within the Kherson so the people are from medical sphere are contacting you, or how the new or are there also organizations that have not been reaching you? Maybe are you open for cooperations? How they can address their requests to you and in which topics? Thank you.
Yeah, thank you so much for the questions. Regarding this cooperation, we receive requests directly from the hospitals, and mostly it's direct communication between the hospitals and HELP. We are open to cooperation with other local organizations because it's help expanding the wider cooperation in the region. We know that many organizations local are working on the field in Kherson, but everything is always related to constraints in security situation. So it's very important to plan in advance the routes. So that's why it's important to have this cooperation, and the organizations are openly can contact us in any questions related to Kherson or other regions.
And a final question, because I've worked for the nonprofit segment as well. Due to that, your organization is not only having the scope within the scope the Ukrainian question, yeah. So how is your department is the department work divided, or your whole organization is prioritizing the crises when they, for example, appear and where you have to be on the first line, so to say? Can you elaborate on that in a short answer?
Yes, of course. It's a prioritization in program department when we see there is a great need in some procurement of some medicines or delivery of some special equipment, or there is like a great need for generators of fuel. We prioritize these regions and try to do this activity as soon as possible to help the people. So everything is, it's difficult to predict what will be the next or in advance because we do not know where the shelling will come or which regions it will affect. Thus, it's a great and complex work of program department and trying to do as much as possible for the needs.
Thank you very much, Lillia. Thank you for your input and
Thank you
time
so much.
taken to participate in this fruitful conversation.